handful of people, okay? Do you know what type of laser you might have used? Don't all speak at once. All right. I'm sorry? 523. So maybe a diode laser, maybe KTP, 532.
532 maybe.
532 KTP, argon, maybe. Okay. All right. So we're gonna go over some different types of lasers. We're gonna go over room setup because that's always gonna be the same, and then we'll get into specifically your CO2 laser. Just briefly, gonna touch on CO2. Who in here may work with ENT or GYN? Couple people, all right. 3 people, I see 4 people, all right. Hopefully I see all of you again this afternoon, so we can go over the laser even more in depth. But just general laser safety, all right. So first off, we're gonna start off with our signs, okay. Hi everybody back here, how are you? Not a proper danger sign, okay. So this is not gonna fly on our doors as notifying us for laser safety, okay. All right. Notice how my glasses are up on my head. That's also not gonna fly as wearing your protective eyewear, okay. We'll talk about more about that in a second. So, this is not our proper danger sign. As funny as it is, you know, as things get left up on doors and walls and stuff, we quit paying attention as over time goes by. So make sure we're always taking our signs down after our laser cases, okay? We're gonna put them away. So, as you can see, our danger signs, they look very similar, right? We have one laser that's gonna talk about our holmium laser. So if any of you are urology people, your Moses laser, oh, part of the seat? No, not so much? Tough crowd. A little too early, guys? Nobody's had their coffee yet? All right, sorry. So, and then our other sign is our CO2, carbon dioxide laser, okay? Both of these lasers, right, are invisible to us. We cannot see that wavelength of beam, all right? So they have an aiming beam. On this laser, it's going to be a red dot. On your holmium, it's a green beam, okay? They're both different types of diodes. So like when me and Jessica are at the club, okay, right? All those lights, beams. You know what I'm talking about. You look familiar. All right. So, okay, that green beam or that red beam is not harmful to you. It's just going to show you where the energy is going, okay? Both these lasers you cannot see. The signs are different, so make sure you have the right sign up for whatever laser you're working with, okay? So today, we're going to be using a carbon dioxide CO2 laser, okay, with a wavelength of 10.6 micrometers. You're like, yeah, Grace? You're like, yeah, I know what that is, right? Right? Yeah, just not great. Okay, 10,600 nanometers, or 10.6 micrometers, is invisible to us. It's on our electromagnetic spectrum, okay, of light. White light we see is, well, technically 350 different colors, but we just see it as white light. But our CO2 is just that 10,600 nanometers, okay? With our CO2 laser, if we plug this in, turn it on, we can actually fire it up to 500 feet, just from the arm itself, okay? But when we attach it to either a different type of lens or a microscope with our micromanipulator for the doctor to use it, that energy can only travel a few feet at max power, okay? So, regarding how far it can travel, that's why we gotta wear a protective eyewear, okay? I do wear glasses most of the time, for not style points, but direction. You see what I'm doing. But with our laser glasses, there's 2 things that are specific to them. They're always gonna have on here labeled for what wavelengths this particular pair of lens protects us for, and also the side guards. They're very stylish. You can wear them to the club. Where'd my friend go from the club? There she is. All right. So, wear your glasses all the time in all laser cases. Does anyone know what would happen if a CO2 laser would hit you directly in the eye? You got a direct ocular injury? Anyone take a guess what might happen? Penetrate what? Would it burn something? Your retina, maybe? Anybody else? Anyone take a guess? Nothing? Okay. I can't. Someone was whispering over here. Something would happen to your eye, right? Yeah, exactly. So if you don't wear your laser glasses, CO2 could actually burn your cornea. Okay, if you're not wearing your glasses. Because CO2 is so highly absorbed by water, by that clear fluid, it cannot penetrate any deeper in the eye, so your retina would not be damaged. Some of you may work with a KTP laser in the eyes, right? That one goes through clear fluid, and so that one will be absorbed by your macula and your retina. So make sure whenever you're working with your CO2 or your holmium, you're always wearing your protective eyewear, as I'm sure all of you do, right? When we're working with lasers, you protect your eyes. Not seeing a lot of heads bobbing here, all right? So, with our glasses, make sure all of our nurses and scrubs are also putting eyewear on our patients as well. We can't just have our eyes taped on our patients, they have to have some type of eye protection as well. So either a pair of glasses, wet towel, or wet gauze. Okay? Room safety, does everyone scrub or circulators and scrubs? You guys do both roles here? Or no? No, sometimes? Okay. Well, who's ever sat at the back table or in the room, make sure you always have either saline or sterile water on the back table in case of a fire. Big basin of water and wet towels around the laser site. Okay? So, we're going to put our proper sign on our door. Do you guys cover your windows? You will, maybe, possibly. Okay, so CO2 cannot go through glass. And so, sir, what's your name back there? Josh. Josh is outside that room. He's looking through the window, right? And I'm like, don't do that. You're with the laser. CO2 cannot go through glass. Okay? So technically, you don't need to cover the windows for CO2. But for holmium, green light KTP, your KTP laser, your argon laser, eye lasers, those ones can go through glass. And so in those laser cases, you would probably cover your windows so that no one from outside the room who doesn't have the proper eyewear on, who's trying to peek in at you, they cannot, see outside there. Okay? So signs, glasses on our doors outside the rooms. Appropriate glasses that are working for whatever laser we're using. Okay? Everyone in the room should wear glasses. If my nurses in here are listening, okay, make sure if the doctor says I don't want to wear glasses, make a little note, Dr. So-and-so decline. Always offer it to them. Even if you know that you can say, no, I don't need that stuff. It's not going to hurt me. I'm firing. I know where it's going. Just protect yourself, okay? Wear your glasses. God only gave you 2 eyes, so let's protect them. Regarding our back table, sterile water, wet towels around the laser site, okay? And please don't, point it at people. Okay? You see the red beam, it's showing where it's going. Don't point it at people. It's not fun that way. Okay? No fun like that, right? No. Okay. So, we're going to plug this laser into our normal 110 wall outlet, boom outlet. Just no extension cords for our laser. As you can see, pretty small little deal here. All 4 wheels pivot, pretty light. On our foot pedal, you guys can cover it with a trash bag if you want to keep it somewhat more clean. But if you keep getting fluids on there, it is water resistant. Plug our laser power cord right in back there. There's a little switch, kind of like on your Bose laser. There's a little circuit breaker switch. That needs to be in the on position. In case that's down, if someone calls me and says, hey, Brandon, your laser's not working, I'll say, did you check the switch in the back? Did you plug it in? Because that really helps too sometimes. We've had that phone call. So Grace, if you call me 6 months from now and you say, hey, Brandon, my laser won't turn on, I'm going to ask you those 2 questions. Did you plug it in? It's happened. And then check the little black switch right here. It needs to be in a position to actually have power to go to the device. Kind of like on our home boxes, circuit breaker boxes. That flips over, power doesn't go to this device. There is no actual key on this laser. The on-off switch is this little green button up here. Okay? Little green button, that's your key. Press that in, the laser will start to turn on. It takes about 45 seconds for the laser to turn on. There's actually a passcode on here, super tough. It's my grandpa's password for everything, 1, 2, 3, 4. You guys all remember that? Pretty tough stuff. But that's your key, essentially, to turn the laser on. Red button up top is your emergency stop switch. If that was pressed down, there's little arrows on here. Just try to give it a twist. Just try to get you guys going, all right? It's Wednesday. Happy Wednesday. Too early? I got littles at home. 5 o'clock's early. I'm fully awake by now. All right, sorry. Continue here. So, green button on here. Laser's booting up. It comes into our login code. You're good. Thanks, Brandon. As our login code comes up to the screen, that code 1234, that's your main pass key code, okay? Please don't change it, because then everybody in the room will know it's changed, things like that. On here, the screen does tilt, so if you're a little taller person, you can tilt that up. It does tilt. What do you think, Paula? Pretty cool? All right. So, 1, 2, 3, 4, hit login. Our system's going to boot up, okay? Now, you can turn this laser on, get it all set up before we plug everything in, that's fine. I'll go over with my ENT GYN people later today on greater details on here. But say the Dr. Jones wants to use the arm with a handpiece or something. Well, you're like, well, how do I get this thing out of here? So, we're going to take first our arm right here out, okay? That's a little dust cover right there. And then we're going to pull from this black apparatus here, and we're going to pull it all the way out, and we're going to take it all the way up until we hear it click. Now, you got to hear the click, okay, folks? Because if this arm is just going to freely fall here, you got to get that spring to lock in. At a hospital in Phoenix, Arizona. Have you ever been to Phoenix? They don't listen very well down there. They called me and said, our arm won't stay up, and so we had to have a person just hold this the whole case. Man, you guys are special. Anyways, goes to click, it holds itself up there, and now it will not fall below 90, okay? So from here, well, that's not a very long arm, so we're going to take this out and let this free fall. And it doesn't matter, this piece right here goes out, this little holder piece goes out, and then you can either have it go this way or this way. Just don't let it freely just drop and bang into something, okay? Because with CO2, every junction where it's re-altering its path, there's a little mirror. If those mirrors get out of whack, the laser's not going to go where you want it to go. Now, that's not going to fall there. It's always going to want to come back up, okay? There's that. Here's my little dust cover. We can take that off. There's my little red beam I was telling you about. Is there any cats in here? What y'all going here? Red beam's not harmful to us. It's just going to show us where it's going. So you don't lose the little red cap. The engineers got really fancy with this system. They put us a little storage spot there. All right. Okay. So on our system. Okay. Don't worry. It's not going to hurt me. Okay. It's not going to go. Just don't point at nobody. All right. Red beam's not going to hurt us. So on our screen, because I know you guys can all see it from that distance. On our screen, you can operate your manual settings. You can operate how this is going to fire, what wattage. As staff, it is not your responsibility to know what setting the doctor wants to use. One thing that I'm going to work with Brandon today on, we're going to print off a quick reference guide to kind of give you guys that settings guide of maybe what type of case you're in, what settings maybe to start at, in case your doctor doesn't know. Give them my usual. What's your usual? We don't know. Also, I'm going to give you a little quick reference guide of everything, how to turn this laser on, how to go through all that system as well. But here's our main treatment screen here, folks. You go to your manual settings there, and then just program whatever settings the doctor wants to use. Okay? Now I understand some of you probably will not use this laser, is that correct? Possibly, right? You guys all work ENT all the time? Sometimes? Okay, perfect. So, on here, we got our arm right here. Say we're going to do a test fire, because I think everybody should learn how to do this. This is your incisional handpiece set, okay? It says incisional handpiece, a little black box here. We're going to set this up, and we're going to plug our system into this. Little handpieces here. One of these may be peel packed for your sterile cases, maybe condyloma, maybe some plaque in the mouth, genital warts, all those fun gifts that keep on giving. Okay, so on our handpiece here, okay, it's pretty tough stuff. Got 3 pieces. This would be sterile, and then your distance guide tip would be sterile. Okay, these just screw in together. Okay, as the nurse, scrub, who's ever operating the laser, this little lens here does not get processed. Okay, so this will be in the box, not peel packed. This should not go down to SPD. This should not be peel packed. See the little lens in there, folks? Okay, might make you see, light a little clearer. Okay, don't process that little lens there. This is going to attach into here. Now, if everyone's turned around, see how bright that red beam is there on our wall there, okay? Now, as I plug in my lens, my focusing lens, it's going to make that energy that could go 500 feet. Well, now it's a lot more pixelated, right? It's a lot more defocused the further away it gets, kind of like a flashlight. Everybody been camping before? Okay? As you shine that flashlight down by your feet, that energy is really intense, really, really bright. But as you shine it down the trail in front of you, that energy, as it gets wider, less intense, right? More defocused, the less energy effect it's going to have. So that's the same with this CO2 energy. So, sterile handpiece here. This is going to plug in here. And then the doctor would use this kind of like just a pen on their tissue, okay? Does that make sense? Okay, the energy is really focused in this one little spot, kind of like that pinpoint precision. The doctor can use this to cut things off, ablate if they need to, okay? Stop some bleeding. Now, with CO2, you might ask, well, CO2, how deep is it going to go? Is it going to cause a lot of thermal effect, maybe like a bovie or something like that? CO2 is very, very minimal depth of penetration, like 0.1 millimeters in depth. So with doctors, they can't put a hole through something really, really fast. It's very, very superficial. And so if they're lasing on tissue, they're going to actually cut it like a hot knife. They're going to be able to resect something away. If they're trying to go really deep and cut something out, it's going to take longer because of that minimal depth of penetration when they're using it. Not a lot of thermal spreads. You should not have a lot of char buildup when you're using CO2. You shouldn't see a big, change in that thermal effect on tissue. It's going to be very precise where they're trying to go. So, handpiece, okay, they can maneuver like this. If you're scrubbed in, you're like, well, do we drape this? If you want to drape it out, you can. This little air hose right here, we can push air down this to push it down our handpiece. That way to try to keep any debris from going up onto our lens. That's all that is right there. If you wanted to drape this out, you can. It's totally up to you, but most likely the doctor will just hold onto this part of the sterile handpiece, and then it just kind of stays there. Great, you want to finagle with it. It's very light. You don't need a whole lot of stuff there, okay? All right, so questions so far? Nothing? Okay. On our system, manual treatment, you go to your settings here, okay? Just so you guys have an understanding of what the screen looks like. All the pages that we just talked about from that home screen that you just saw, they all look the exact same like this. One just is you can use the arm, and one can use the fiber, okay? On our system, the doctor should tell you what setting they want to use. Either continuous wave, the CW, or super pulse. That's going to be our energy, okay? Continuous wave or super pulse. Continuous wave is going to be more ablative. It's going to have more effect. Super pulse is going to be more of that kind of a shudder on there, okay? On the bottom bar where it says repeat, single, continuous, that's going to be our foot pedal down here. Single, repeat, or continuous, that's how your foot pedal is going to work. Up here, CW or super pulse, that's how the energy is actually going to be relayed to that target tissue for the patient. Your doctor will tell you what setting they want for the wattage. You can either hit inside that track bar, or you can do the plus or minus to adjust those settings. The system goes up to 40 watts. You will never, as staff, use probably above 15 watts. Even though it's a 40 watt system, you'll probably never go higher than 15 watts. With either a handpiece or in throat or even with the fiber, you're not going to go above that. It's just, this issue doesn't need that much power. Ready, standby. Bottom right corner of the screen. When you hit ready, make sure everyone in the room has their glasses on. Make sure your signs are up. Make sure your glasses are on, everyone, including the patient. Okay, water on the back table. When you go into ready mode. Okay? Also, when you're in ready mode, someone should be by the laser when the laser is actively being used. Okay? Alrighty? Any questions? Comments? Criticism? Did I talk too fast? Have too much energy at 6:30 in the morning? Possibly. Alright. So, if we're in here, you're not going to have a total time or total energy transfer to your patient. For my nurses, chart the time you turn the laser on. Like put it in ready for the first time. The last time you put it in standby, that would be your off time. Your wattage that you used, you can, if you wanted to chart your continuous wave or super pulse, you could chart that if you have that ability in your charting system. But most of the time, you just chart your CO2, and then you would chart whatever wattage that you used. Okay? There's no total energy stored on you. Okay? Start and stop time and then energy. Everyone wore their glasses, chart that, right? Okay. From there, go back to your home button, bottom left corner, ET phone home, hit the little home button, take you back to that login screen. Okay? Maybe you came in here and you mess with settings and you're like, well, how do I get back to my original starting settings? Just go back to home, and then you can go back into manual treatment. Okay? Fiber is pretty simple. We're going to use our fiber. We'll plug in there. If you're going to use fiber, you do not even need to take the arm out. We can just choose the fiber setting on the screen there, and we can plug our fiber in right here. Okay? Your fiber is a one-size fiber for all cases. There's not different sizes, bless you, like holmium. And so for our ENT staff, we'll go over that later this afternoon. For our arm, maybe you want to put this away because you're all done with it. And you're like, man, it won't go down. How do I do this? Well, first off, we're going to take off our lens. Okay? Put our arm back. Like I said, it doesn't matter which way you want to go with it. It's like a newborn baby. You don't got to be super gentle with it, but you want to be a little bit firm, right? We have kids at home. They're not breakable, right? You think? Right? Okay. So, we're going to put our arm away right here. Okay? My simple teaching aspect, because I know you guys will all remember this 6 months from now when you guys use a laser. Words on here, on our arm right here. Okay? There's going to be words on the screen. So I don't want to put my arm away when it's like this, because that's looking at me, that's weird. Okay? Words right here. See that? Okay? And it tells you how to stow this thing away, how to put the arm away. There's a little black button. There's a little black button right there, guys. That little black button goes down. Doesn't go in, doesn't go left or right. Go up, it goes down. Hold onto your arm here, okay? And find where that button wants to go down easily. And that releases the spring, so this can drop. Hold on to this, okay? So if you let go of this, it doesn't just bang at you right in the face. I sit my head all the time on stuff. Okay. Lost a lot of brain cells over the years. Okay. Find that happy spot. If you're trying to force it and you feel that resistance in the arm, okay, your spring didn't release, take it back to all the way up and find it where that wants to drop freely. Okay? And you can put this away. Alright? If you want to practice, by all means come over here, you can play with the machine and ask any questions because you don't want to ask in front of a large group. Okay, so before we turn the laser off, we do not want to just hit this button right here. We want to wait. We want to take back our laser back to the home screen. And then in the bottom left corner, there's a log off option. Always make sure you're logging off on your laser, okay, before you actually turn it off. So we're going to hit the little log off button, bottom left corner down here. Hit the log off button. Did I hit it? It's going to take you back to your login screen. Our initial 1, 2, 3, 4 screen, okay? Go back to your initial login screen, and from there, that's when you can hit your button and turn the machine off, okay? In the event of emergency, when you're using the laser and you're on your treatment screen, yes, hit your red button in, that's going to shut down the laser, okay? So shut it off completely. That's perfectly fine. Untwist that red button when the emergency is handled. Untwist this, fire it back up, and continue your case. Very important when you're using your CO2 from the arm, always do a test fire. Test fire on a wet tongue blade, wet towel is your backstop. Reese, we're smart guys, right? We have a beard, we're cool, right? All right, we're not the smartest fellas, but sometimes, you know, early mornings happen. Wet tongue blade, test fire on a laser, and you want to use your hand as the backstop. Don't do it. It's not going to feel good when you put a hole through that tongue blade and you, okay? Wet towel, mayo stand, prep stand, just not your hand, right, Josh? Yeah. Okay. Questions, ladies and gentlemen? Anything? Nothing?
What's this arm thing?
Oh, that's a good back scratcher you're gonna deal with. You will not use it. I'm gonna take it off before I leave today. It's a conversation with me and Brandon later. We're not gonna use it. Anything else?
How many glasses are you sending using?
So I see 3 on here. You guys can also use your Homium YAG, your Homium urology glasses. Those are universal for both Homium and CO2. The ones that are in here are strictly to CO2. And so that's why I think we talked about ordering more just CO2 glasses, because they've come a long way. They're very stylish, these ones. Okay. Ooh, ah.
Can I put it over my glasses?
Go ahead, come on over. Model. Go ahead. There you go. Ooh, ah. Thank you very much, appreciate it. All right, any other questions?
Where does the lens go? Not to SP.
Not to SPD. Okay, so my scrubs in here, separate those bad boys, okay? This goes back in the black box with the system, or with wherever the system's going. These can come apart, put them on a towel so they don't get lost, or keep them together. If you find them in these in peel pack and this is still together, technically that's not clean. Have it reprocessed, okay? Okay? All right, everyone wear glasses, signs, right? Water on the back table. If you have a laser that has a key in it, never leave the key in the laser if the laser's left by itself.
Those are kept at the front desk.
Okay? If you have,
Go back to the front desk.
If you have a laser that has a key, don't leave it in the ignition. It's not going to be mixed to ignition, hot and fresh out the kitchen. All right, everybody gets that. You guys are waking up now. Okay? Don't leave the key in the laser. It's a big OSHA violation. All right, make sure everybody's taking the key back with you. You want to put it on like a hubcap, like an old truck stop, gas station, so no one steals it. Put some scrubs. Okay? All right? Make sure you got the right signs on, doors, glasses. Everyone in the room is wearing glasses, including our patients. Water on the back table. Safety, communicating what settings you have on the laser with your doctor. Okay? If you have questions, before I leave, I'll put my card on here. Give me a call. I do a lot of laser stuff, so I have to answer a lot of your laser questions. God bless you all. Have a great day.